Great. So good afternoon, everyone. Welcome to today's webinar on children's unique vulnerability to climate change. My name is Dr. Sherry Weiser, and I co-founded and co-direct the University of California Center for Climate Health and Equity. The mission of our center is to harness the expertise and leadership of the health sector to drive ambitious climate action for health and health action for the climate. Our center is based at UCSF, but it spans all 10 UC campuses and 5 health systems with over 100 affiliated faculty. So today's webinar is the first of our spring series called The Health Impacts of Climate Change Across Our Lifespan. And with this series, we will explore how climate change is impacting health across our lifespan from birth through childhood into adulthood and older age, and also about its cumulative health toll over time. Today, we'll be focusing on children and their unique vulnerability to climate change. And our next webinars over the next 2 months are going to cover climate change's effects on adult reproductive and occupational health and heat illness, chronic disease management in the face of climate change, and mobility during natural disasters among aging populations. And we'll be recording all of them and sharing the recording with all registrants. And just note that registration details for the remaining webinars are forthcoming. So as we launch this new seminar series, I wanted to thank the UCSF Academic Senate Committee on Sustainability for its excellent support and contributions. So today we have a wonderful lineup of speakers, and it's my pleasure to introduce today's moderator, Dr. Pooja Singhal. Dr. Singhal is an outpatient pediatrician at Berkeley Pediatrics. She received her undergraduate public health and medical degrees at the Johns Hopkins University in Baltimore, and then moved to the Bay Area for pediatrics residency at UCSF. She's passionate about environmental sustainability and has previously lectured on climate change and its impacts on pediatric health. And she's also been involved in many important efforts to make outpatient pediatric clinics more environmentally friendly. And I will now turn it over to Singhal, and thank you all for being here.
Thanks so much, Dr. Weiser. And thanks to everyone for being here today. I'm really looking forward to our presentations and our conversation on pediatrics and climate change. When I first started learning about the enormity of the issue of climate change and health, it felt really daunting and inescapable, not only in its effects on a personal level, but also in the way it increasingly impacts my patients in primary care pediatrics. I think sometimes it feels like the problem is just too big. But over the past decade, I've had the good fortune to both learn from and deliver some talks on the topic, and in the process met some truly incredible people doing amazing things to chip away at this enormous issue. One of my favorite parts about these talks is not just what you learn, but who you meet and the collaborations that you can form to share experiences, encouragement, and frankly, motivation to be a real part of change. As Dr. Weiser noted, my personal current area of interest is greening clinics and outpatient spaces. I'd love to chat with any of you out there doing the same sometime after the talk. I now have the distinct pleasure to introduce our featured speakers, Dr. Lisa Patel and Dr. Karen Dunderstadt. Dr. Patel is the Executive Director of the Medical Society Consortium on Climate and Health and a Clinical Associate Professor of Pediatrics at the Stanford School of Medicine. She is a former Presidential Management Fellow for the Environmental Protection Agency, where she coordinated the U.S. government's efforts on clean air and safe drinking water projects in South Asia in collaboration with the World Health Organization, and received the Trudy A. Spesinar Award for her work. She's a member of the Executive Committee for the American Academy of Pediatrics Council on Environmental Health and Climate Change, and a faculty mentor for Stanford Climate and Health. Our second speaker will be Dr. Karen G. Dunderstadt, a clinical professor emerita at the University of California, San Francisco School of Nursing. She is the past director of the Pediatric Nurse Practitioner Program and completed her PhD at UCSF in nursing and health policy. Her research focused on access to care for low-income children. Her clinical practice was at the Children's Health Center at the Zuckerberg San Francisco General, and she cared for the urban Latino and immigrant population of children and families. She's currently working with California Nurses for Environmental Health and Justice, CNEHJ, and the California Alliance of Children's Environmental Health, CACHE, advocating for climate legislation. Without further ado, I'll pass it on to Dr. Lisa Patel.
Thanks so much, Dr. Singhal. I appreciate that introduction, and it's wonderful to be here. Just going to share screen. So today I'm going to be talking about, Dr. Duderstadt and I are splitting up a little bit, and I'm going to be talking about infants and early childhood to talk about climate change's unique effects on this particular population. I think when I've been studying climate change now for more than 25 years, and 25 years ago, the way climate change was framed as a distant problem for a distant species like the polar bears. But I think we can all appreciate that climate change is here. It's occurring in all parts of the globe in different ways. It is now we are experiencing the effects of climate change every day in some way, shape, or form, and it is us. It isn't just a problem for the polar bears. It is profoundly an issue of health and health equity. I really like this graphic from the Lancet Countdown that says every child born today will be affected by climate change. How we respond will determine the world we live in tomorrow and will shape the health of children across the globe at every stage of their lives. I could talk about the myriad ways that climate change is going to be affecting health, but I like to keep it personal and dial down to just a couple of issues today to provide examples of the various ways that climate change will be playing out. So I'm a hospital-based pediatrician at a community hospital where I work in a NICU. I attend deliveries and care for children that need hospitalization. I think many of us that have lived in the Bay Area for a few years now remember when the sky turned orange because of the overwhelming wildfire smoke. And during that season, I walked into our NICU and the amount of smoke was so overwhelming outside that you could actually smell that smoke inside of our NICU. Infants that were 32 weeks and up were breathing that very foul pollution. Some of the studies are showing us that wildfire pollution is more toxic than the regular air pollution we breathe. One study estimates that it's 10 times as toxic. And wildfire smoke isn't the only way that that I feel is that I've seen clinical care being affected. We also had the power shut off at 9 o'clock one night without any notice from PG&E because it was a high wind event and there was concern because it was a wildfire period that it could spark wildfires as well. And we learned from that situation what parts of the hospital got backup power and which ones didn't, and the postpartum unit. So individuals that had just delivered their babies were walking around in the pitch black dark. Why we worry about pollution like wildfire smoke or the burning of fossil fuels from things like electricity generation in our transportation sector. Well, one of the pollutants we worry about in particular is something called PM 2.5. A pregnant individual breathes that pollution in, and that pollution is so small, so tiny, we now understand that it actually crosses the placenta. There was a study that showed that there was evidence of that pollution in a developing fetus's brain, lungs, and liver, indicating that there's a much longer exposure window to this foul and toxic pollution than we previously understood. As I mentioned, particulate matter pollution, whether you burn anything, whether you're burning, whether it's a wildfire that's burning or whether we're burning fossil fuels, forms these tiny little particles that are basically the fraction of a width of a human hair. We breathe that pollution in, and it basically sets off essentially like an inflammation cascade within our bodies. We have very good evidence, having studied the effects of fossil fuel pollution on health, that fossil fuel pollution is a driver for poor health outcomes like a shorter lifespan, stroke, heart disease, asthma, lung cancer, and reduced lung function. That graphic on the bottom, also the outcomes in blue or green are ones that are emerging evidence for. As I mentioned, there was a study that showed that wildfire smoke, we estimate, is about 10 times as toxic to a child's health compared to regular air pollution. And the way that data was gathered was looking at apples to apples. If you have an air quality index of 50, if it's just fossil fuel pollution versus a wildfire smoke day. So the same amount of pollution resulted in 10 times as many children showing up with respiratory complaints when the pollution was as a result of wildfire smoke. Why are children in particular, and particularly young children, so vulnerable to wildfire smoke? And the second effect I'll talk about, which is heat. When we think about vulnerability, we put it into three buckets. So that sensitivity, exposure, and adaptive capacity. So young children and infants are particularly sensitive because, especially in the first few years of their lives, they have rapidly developing lungs, brains, and immune systems. There are also differences in physiology. For example, a child breathes faster than an adult, so pound for pound, they're breathing in more of that pollution. Young children and infants are often more exposed. They can spend more time outdoors. When we're thinking about things like heat, for example, and children experiencing poverty or children of color are more likely to live in red-lined areas that can be measurably hotter compared to other areas, exposing them more to these types of climate threats. And then adaptive capacity. So children are really reliant upon adults for their safety and their comfort. A child who's hot in a classroom can't just raise their hand and say, I need to go outside. A child that's been left in a hot car similarly can't leave. There's a problem with children are also, especially younger ones, are developmentally immature, and so may not be able to take the actions for their comfort. An infant, for example, can't kick blankets off if they're too hot. And then lack of family resources. So I work with a patient population at the community hospital where I am, where families are at times struggling to put food on the table. And so they may not be able to pay their energy bills, even if they had access to air conditioning, or they may not be able to invest in a portable air filtration device to be able to keep their indoor air quality clean and keep their children safe from the threat of things like wildfire smoke. I had the opportunity with a colleague of mine who lives in Michigan, and this had been, this is Dr. Alex Rabin, and he's a critical care doctor. So this was his first experience with severe wildfire smoke last summer when the wildfires from Canada blanketed many parts of the United States with wildfire smoke. So we had the opportunity to write a piece for the New York Times on why children in particular are vulnerable to all of this wildfire smoke. There was a really nice systematic review meta-analysis that just came out earlier this year on wildfire smoke exposure during pregnancy, looking at perinatal, obstetric, and early childhood health outcomes. And what they found was that exposure to wildfire smoke during pregnancy increases the risk of low birth weight, preterm birth, congenital abnormalities like gastroschisis and spina bifida, and increased child mortality in low middle income countries. I'll tell you, in my experience as a neonatal hospitalist, anecdotally, I found that to be true. So during periods of wildfire smoke, our NICU tends to fill up with more infants between the ages of 32 weeks to 40. And what feels like a compounding factor to all of this is I work in a place that is increasingly becoming a healthcare desert. So we're getting more and more pregnant individuals that have to travel farther and farther and come to our hospital at 26 weeks, at 28 weeks, seeking care during times of climate distress. And we are not positioned to take as good care of them as a level 3 or a level 4 NICU, for example. So we've touched a little bit on wildfire smoke, and I just want to take a moment to outline that climate change will really leave no organ system untouched, no life stage unaffected. And I only have 15 minutes here, so I'm not going to go over all of this, but this is to set up what the series hopes to do and show that really at every stage from the time that a fetus is in utero to when they become a young child to an adolescent to an adult, at every single life stage, there are effects of how climate change will be affecting health. There's actually even some evidence to show how things like PM2.5 pollution are changing things at the epigenetic level. So even pre-conception, there is some concern for how these effects are playing out in terms of fossil fuel pollution in particular. When we think about organ systems, so there are neurocognitive effects that we worry about with various impacts of climate change, including things like toxic stress and the air pollution that we're breathing. Our lungs are affected by lung function, asthma, and certain forms of cancer during periods of extreme heat and air pollution days. There are cardiovascular effects as well, and then musculoskeletal and renal effects from things like extreme heat and dehydration. As I mentioned, when we burn fossil fuels, two things happen. We release a whole bunch of toxins into the air that cause these effects that I've discussed on the left, but it also drives climate change. It causes the release of greenhouse gases. And what we understand from the way climate change is getting worse is that we are going to see these large societal impacts. So we're going to see things like malnutrition. We're going to see more and more climate disasters that cause displacement and worsen mental health and cause physical trauma as well, and then worsening heat-related illness as well. The second impact I just want to talk briefly about is heat. And I don't know if folks had followed this story. It happened a couple of years ago. It was very tragic. It was a couple and their infant and dog that were all found dead in the Yosemite Hills on a hot day. And officials were really puzzled by it. They didn't know in the beginning what had happened, and they thought maybe the couple had drunk some water. There was a toxic algae bloom, and thought maybe they had had some of that water, and that could have caused them all to die. Or there was a mine nearby. It was a carbon monoxide poisoning. Well, it turned out it was heat exposure. So they had gone on a hike. Part of the area there had burned during the last wildfire, so there wasn't the cover that they were expecting in terms of shade. And then the temperatures climbed pretty quickly to 109 degrees. What they think happened is that the infant started showing some signs of heat exhaustion first, which you can expect because children's body temperature, especially young infants, can rise 3 to 5 times faster than a grown-up's. And so they think that the mother tried to climb up the hill to get back to the car. By this point, probably both of them were pretty disoriented from suffering from heat exhaustion themselves because they didn't bring enough water. And so they found the mother on the hill, they found the father and the infant and the dog below, and they hadn't made it out. And ultimately they were diagnosed with heat exhaustion and heat stress. I think most people don't recognize that heat is actually the #1 weather-related killer, and we can expect it to get worse with time. As a pediatric hospitalist, I have cared for toddlers and infants that have been left in cars. I grew up in Houston, where we are more adapted to hotter weather than a place like Northern California. No child should ever be left in a car, but I think often people in places that haven't been adapted don't often recognize how quickly it can get very hot inside of a car. I also work with the population that I work with is Medi-Cal, often are on WIC or SNAP dollars. So can't, even if they had access to air conditioning, may not be able to pay for it in terms of their energy bills. In the last heat wave that we had last year, it was in the middle of a heat wave, and I knew to ask my families that whether they had access to air conditioning, knowing the data that infants are actually at higher risk of mortality in their first week of life if they're born during a heat wave. And one of the families actually did not have access to air conditioning. It was 110, 112 degrees. And so we worked with a social worker to find them a family to stay with. We will usually talk about cooling centers, but a cooling center really isn't an appropriate place for a family that has a brand new baby. So making sure that our providers are aware of what these risk factors are and asking these questions to families to ensure that, that infants and young children remain safe. As we think about heat vulnerability and health impacts, we know that pregnant individuals are at higher risk for adverse birth outcomes. This was a paper that was put out by Bruce Beckar and colleagues that looked at a higher risk for things like premature birth and low birth weight, with emerging evidence for stillbirth as well. And then infants in particular cannot effectively thermoregulate in the first week of life, placing them at high risk of death. The final note that I wanted to make about this is that the impacts of factors such as heat and air pollution are not borne equally. And these are just a few examples of how these inequities play out in the Bay Area. We know that certain populations are more exposed, and West Oakland is a perfect example of this. This was a previously thriving Black American community that became encircled by a freeway, and all of that diesel exhaust and pollution gets thrown into these communities that results in poorer health outcomes. I really like this quote by Hop Hopkins, who says, "You can't have climate change without sacrifice zones. You can't have sacrifice zones without disposable people, and you can't have disposable people without racism." So as we think about climate change, we always have to be a center in our thinking that there are those that are going to be hit first and worst, and those very people were the ones that did the least to contribute to climate change. The final piece in terms of health, and I just want to be mindful of time, so I leave enough time for my colleague to present, is mental health and toxic stress. Climate change is a health risk multiplier, so it takes existing stressors, things like poverty, housing insecurity, food insecurity, mental health, and makes these things worse. We understand that toxic stress, especially the more toxic stressors a young child experiences in their lives, sets them up for a host of physical and mental health issues down the line. And so what I worry about as a pediatrician is that climate change really disrupts a child's ability to live in a safe, stable, and nurturing environment. We are expecting that if our emissions continue the way they have been going, that about 200 million people could be displaced by climate change worldwide. Within the United States alone, we expect with the coastline erosion and the way weather patterns are playing out, that 11 million people could be on the move. And what that means for the stability of our society and the stability for children's health in particular is deeply important to the lifetime of their health. I know I've provided a lot of depressing information, but I also want to provide some points of hope. The Inflation Reduction Act and several new rules by the Environmental Protection Agency will help us cut fossil fuel use, but they're under threat. And what can each of us do to secure these gains in 2024? We can vote for leaders who have plans to address the climate crisis. So the last note I just want to say is that the problem is big, but so is our opportunity for change. If you'd like to learn more about how you can leverage your voice or learn about issues as they relate to climate, health, and equity, advocacy, and policy, I welcome you to scan this QR code and learn more about the Medical Society Consortium on Climate and Health. And with that, I will turn it over to Karen.
Thank you, Lisa. Dr. Patel, that was an excellent presentation. Thank you. Got my slides up. So I'm going to be focusing on more on the children and adolescents and their impact of the environmental health risks. Next slide. Do you want to? Oh, thank you. And air pollution. We all know the various sources we have of air pollution in the Bay Area, and I want to talk specifically about our current ratings for air pollution. Next. So these are the 2023 standings from the American Lung Association. They come out annually. We'll have new data coming up out in April, so shortly I'll be interested to see that. But I'm always quite surprised. San Francisco to San Jose, we were out of 227 metropolitan areas, we still are 11th worst for high ozone days in the Bay Area, 6th worst for 24-hour particle pollution, and 7th worst for annual particle pollution. This is out of the 200 metropolitan areas that were tested nationally. So we have a lot of work to do here in the Bay Area. Sacramento and Roseville, as you can see, are slightly better. They do have a higher particle pollution. This, I think, is related to the agricultural industry that they're all exposed to. So hopefully the 2024 ratings will be slightly better, and I'm anxious to see what those are. Next. Dr. Patel talked about the wildfire smoke, with a composition that particularly affects infants, children, and adolescents are carbon gases and nitrogen oxide, the volatile organic compounds. And we know so many houses burned in our wildfires that all of the compounds within the houses were also released into our air. Particulate matter, the size of particulate matter is really critical to infants and children, and also the release, as I mentioned, of household products. And air pollution and air pollutants, specifically with the PM factor, are related to the development of asthma exacerbation, the impact, growth, and development of lung tissue, which Dr. Patel touched on, low birth weight, and also the concern for children and maturing children is in neurocognitive effects, which include ADHD, school performance, and memory. Next. I wanted to talk specifically about the combination of air pollution, asthma, and microbiome. This is a new area that has been under study for more than a decade, and I think has also impacted our current treatment and medical therapeutics, specifically because we know the impact of the microbiome. The microbiome influences asthma development, disease progression, and also our treatment efficacy with the high steroidal content of our treatments. Lung colonization actually mirrors the gut microbiome, and this is something that perhaps others were not completely aware of. And the gut microbiome diversity is different in children with asthma. And the asthma therapies, as I mentioned, influence the gut and the gut microbiome. And I think, again, this illustration of those who have a higher protective microbiome and the lung condition as compared to those with asthma, daily treatments with steroidals, et cetera, that there's really significant difference in our microbiome, which is, as we know, is very protective and Also in hospital setting and outpatient setting, we've continued to try to increase with probiotics and other products the microbiome. Next. The monitoring became very important to us, of course, during the days of poor air quality in the Bay Area. I was advising families frequently on the sensors that they should, the air quality sensors. Particularly, I use the purple air. If you have others that are on the call or on the webinar that you're interested, that you look at regularly to evaluate for your personal risk for air quality issues or your families, then please put those in the chat because there's a number of sites. We know what the mitigations are. And the other thing that's really important, even in our Bay Area and in San Francisco, these were February and March. I've checked in those days, and you can continue to see that there's a very different air quality, as we well know, between communities in San Francisco. Those, again, that are near the freeway in the Bayview and other areas have a much higher risk on a daily basis than those of us that live in other parts of the city. Next. Schools also are impacted by air pollution, and indoor air pollution is what I wanted to focus on in this slide. We continue to be concerned about the effect of the schools in the Bay Area, and particularly in San Francisco, and the age of those. Indoor air pollutants are mold and dust, the formaldehyde, carbon monoxide, and also our cleaners and pesticides. And it's important for schools to monitor indoor air quality and try to minimize the risk to children, particularly with humidifiers, air filters, and the limit of harmful pesticide. And our goal, of course, is to increase this awareness and to change the school environment. And parental advocacy makes a big difference in schools in this area. Next. Heat stress, Dr. Patel talked about this slightly. I just wanted to make a few points. Again, that children produce more heat per kilogram than adults. They have a higher surface area to body mass, lower rate of sweat production, and they're definitely more vulnerable to extreme heat. Next. And I think one of my concerns, and our concerns as healthcare providers, is that you can look at this illustration to see that the severe symptoms in adults are very recognizable and very significant. You look at the severe symptoms in children, and the example of the couple in the sad example of the couple in Yosemite, they're crying without tears, sunken eyes or forehead, which is a later sign, vomiting and diarrhea. And with adolescents, I think, which is a particular concern, they have deeper severe muscle pain, and that may be, of course, following exercise. But the initials are nausea, headache, which can be from severe or intense exercise. And those children and adolescents who have asthma are particularly vulnerable. So I think we need to be very aware of the signs, the difference of signs in heat stroke or heat symptoms in children as compared to adults. Next. The other piece that I wanted to talk about was infectious diseases and the change that we're seeing in our patient population in terms of vector-borne diseases. The vector-borne diseases are sensitive to higher temperatures, and that leads to an increase in range of vectors and also length of seasons, and that's what we're seeing in the US. Children are more vulnerable due to typical play behaviors, the time outdoors, and also contaminated water sources. And in San Francisco General, we've had several of these vector-borne diseases. Certainly Zika, we had cases of malaria despite prophylaxis. The West Nile virus is becoming much more common in the Southwest and South. And chikungunya, I always have a problem saying that. We've had rare cases in the US, but that is also, vectors are changing. So that's a really important one. Dengue fever, we're familiar with. There's been cases in Texas and Florida. And children bear the highest burden, 88% of all disease associated with climate change. And that produces a significant amount of trauma and stress in many children. Next. So the waterborne diseases also are posing a threat to us in our environmental health. The non-cholera illnesses, which is newer to me in terms of looking at the literature, that the Vibrio illness, they cause diarrhea, abdominal pain, and skin infections. And these really are because waterborne diseases are also impacted by rising temperatures and the increase in insect and animal populations and the change in participation in our warming oceans. We know certainly even off Ocean Beach, we have significant warming in our oceans and up and down the Bay Area. So that brings in different vectors and different waterborne diseases, and therefore we will continue to see more of this in the future. And there have been cases in the South and in the Southwest. And generally the causes can also be foodborne or contaminated water sources, either one. Globally, diarrhea diseases are primary cause of mortality in children, and WHO predicts, unfortunately, an increase in diarrheal mortality annually due to the impacts of climate change. Next. Community water supplies, we're aware of the different exposures that we have to different chemicals in terms of the water supply, particularly the manufacturing facilities and also urban and agricultural runoff. This is a high risk in California. Next. The water quality, the recent California law required licensed child care centers to test for their tap water. Again, lead is a contamination that isn't exactly related to climate change, but we've seen issues like in Flint, where policy decisions related to climate change did impact children. So it is an indirect and direct impact. The study looked at monitoring 1 in 4 California's child care centers had levels of lead in drinking water that were exceeding state requirements. And this is a current study, 2023. The lead is a neurotoxin, as we know. Dr. Patel went over these symptoms, and the AP recommends a lead level not to exceed 1 part per billion. But we continue to have problems with this. There has been significant legislation in this state. However, the upgrade in our plumbing structure throughout the state is really not supposed to be implemented until 2027. So there's a current bill in the California State Legislature in 2024 that's looking at the mandate of installing water filters. So hopefully that will come into play more recently in California. Thank you. Next. Yes, Dr. Hana Atisha, she is one of my heroes, and we're very familiar how she was very chided and really pushed even from her own pediatric community for her findings. And again, of course, they all were true. She wrote a recent article in the Journal of Pediatric Healthcare that looked at the long-term outcomes of the children she's been dealing with over the past 10 to 11 years. Next. So I then want to talk about climate change and the chemical hazards. This is a whole area that we're surrounded by, but we don't have the awareness of other climate impacts, such as air pollution. Next. Unique behaviors. I think Dr. Patel went over this, so definitely the chronic low-level exposure may become toxic over time. And that's one of the concerns about, those of us in adult and even in adolescents who were exposed to some of the chemicals that are in higher contamination areas now. We had a briefer part of exposure, and also we're fully developed. It's different in children because of their higher intake of food, their hand-to-mouth behavior, et cetera. And also we need to consider children with special healthcare needs. So this continues to be highly vulnerable for children. Next. Also the vulnerability, particularly with chemical toxins, impacts the immature liver enzymes and leads to increased blood levels and prolonged half-lives of ingested chemicals, again, because of the developmental stage and age of children. You think about the brain developing fully in the first 2 years of life and how critical that is, which Dr. Patel talked about also in the uptake of those climate change effects early on. It's interesting because in therapeutics, we have well-documented drug pharmacokinetics, and it's not well studied in environmental toxins. The subclinical toxicity to environmental contaminants is a concern, and we're not testing for it. Certainly in our state, widely for our Medi-Cal population, we tested for lead at 1 and 2 years of age, but that's the only mandatory testing we have in the state. So we're not aware of what the contaminants are and the toxicity that our children are experiencing. So that's an important area of advocacy for healthcare providers. Next. There's current gaps in our knowledge about developmental toxicity, and we know that, again, Dr. Patel covered this, the fetal brain is particularly critical in the development, and that's significantly impacted by toxic chemicals. Next. I think the bioaccumulation over the long term is a significant concern, and it's linked to subfertility and cancer. We've had reductions in male fertility and declines in the number of males born over the past decade. We've had abnormalities noted in male reproductive organs from our bioaccumulation of drugs related to particular reproductive organs. Female reproductive health issues have also been a problem. Increased infertility, we're seeing that over the past decade. Early puberty, we've noticed now, can begin at 9 or 10 in some children. Ovarian cancer and prostate cancer. And we also, of course, are seeing an increase in immune and autoimmune diseases and severe neurodegenerative diseases. So these are all related to our accumulation of chemical hazards over a longer period of time. Next. The pesticide exposures are also really concerning that we have. And again, we're not testing for them. We're not particularly aware. But I wanted to point out one of the recent studies by my colleague, Dr. Abby Alcon in the School of Nursing. And she did a recent study in Northern California on preschool-age children's pesticide exposures in childcare centers and at home. She monitored their exposure with the silicone bands, which I thought was an interesting new approach. And you can imagine those who are parents on the call keeping a silicone band on a child at home and in daycare over a period of time. She started with a large population and then had a smaller population for the final N. But she did get very good and substantial data from this. And it was essentially looking at pesticide exposure, as I mentioned, not only in childcare, but at home. And there were 4 common pesticides detected. You know, you're familiar with the chloropyrifos and also the permethrins. These are common in our environment. And then the others are more specifically related to pesticide use throughout Northern California, particularly in our educational areas. And they looked at the sources for these exposures, both in the home and in the childcare centers. And they found that pesticide chemical storage outside in both the home and preschool was part of the problem. Cracks in the walls, which can allow that to leak through into the interior of buildings, using doormats, which I thought was an interesting point in terms of children tracking pesticides in and out of the area, and also an increase in pests, which also are carriers. She's continuing the further study in this area on the behavioral effects and how those are linked to a pesticide exposure. So this will be interesting when she comes out with this study. Next. And finally, just further a little bit on the climate change of both children and youth. Next. Psychological impacts and the adverse child events continue to be a huge problem in our population. We're seeing an increase in mental health and behavioral health problems and decreased socialization. So I think particularly adolescents are primarily impacted like this, and we're seeing it on a daily basis. The events, the ACEs events they're intense, frequent, and have sustained exposure, and that leads to toxic stress. And we're seeing this in our adolescents particularly. It results in the impact on the immune system, dysregulates the endocrine system, and does not allow the body really to return to homeostasis. The wildfire season was really significant in California over 3 to 4 to 5 years. And these we know have had long-term effects on our youth, and they're concerned about climate change on the long term. In smaller children, also can lead to problems with learning difficulties, behavior problems, as we saw in the previous study. ADHD, obesity, asthma, and dental health as well can be impacted. And it creates trauma that can lead to toxic stress and aggravate ACEs of childhood, particularly in our low-income and vulnerable communities. And that's a key issue throughout everything we've talked about today, Dr. Patel and I both. Next. I do think there's opportunity for action. We don't always need to be at this tertiary prevention in our tertiary centers. Secondary prevention we can work on even in terms of advising families about air quality, about toxic exposures in the area that they live in, and also in terms of making choices about, as consumer products, what we purchase, what we're surrounded by. These are all really significant in terms of secondary prevention. And primary prevention, as we know, is really in the area of advocacy and improved public health policy. And California, fortunately, for those of us who live in California, is a real leader in this area. Next. And further part on advocacy and policy action, I'd like to talk about just very briefly, because I think I only have a few more minutes. Next. So as I mentioned, our state is leading the way, and California has 17 current policies and 45 adopted policies related specifically to chemical hazards within the state. And we really have continued to be a leader in this area. You can see the states that have poorer policy and the states that are better policy. And this is a very, the safer states, if you're interested in our current policy, please go to this. And you'll really see, also if you have family living in other states, really see the difference in those who live in states that are really active in terms of their chemical policy. Next. One of the successes we had, which I thought I'd share with you today, was the California Food Safety Act. And this was enacted in 2023. It was the first law in the US to ban 4 harmful chemicals from candy, cereal, soda, and other processed foods sold throughout the state and in the US. And we were one of the first states, California was one of the first states to do this. New York is currently having a lot of policy discussions, but they have not completed their legislation in this area. And the EU banned these substances more than a decade ago. So EU was definitely ahead of us in a lot of their chemical policy. And this ends the food uses of brominated vegetable oil, potassium bromate, which we see in a lot of our products, the parabens, and also red dye number 3, which is found in baked goods, as I mentioned, candy, cereals, and sodas. And these foods are actively linked to health problems such as hyperactivity, nervous system damage, and an increased risk of cancer. I just wanted to make a quick point about when Governor Newsom signed this, he actually attached a bag of Skittles from the EU that he sent to the legislature and saying, congratulations, we finally removed this product from red dye number 3, and Europe did it 10 years ago. So that was a very interesting point in the policy in California. Next. The PESHUs is a good site for us in terms of toolkits. There's a variety of other toolkits out. They're in my resources that you can take a look at, but they have information on environmental hazards, the exposure sources, key concepts, and then anticipatory guidance. So the Western PESHU states is very active and also has close coordination with UCSF. And next slide. So I think as nurses, nurse practitioners, APP providers, we can build knowledge of chemical hazards, particularly on evidence, and we can identify possible toxins in a child's environment and counsel families about preventative measures to limit chemical exposures. We can increase families' awareness of connections between behavior, conditions in the home and school, and environmental exposure-related illnesses. And then last, I think we need to enlist legal and other environmental advocates and California legislatures to continue to lead in this type of policy throughout the state. And I think we can become leaders as we move forward as well in the next 10 years. And we want to identify and reduce local environmental hazards as well as nationally and globally. Next. And just the last piece, which was mentioned in my bio, that I was one of the founding members of the California Nurses for Environmental Health and Justice. This is a new organization in the past 3 years in California that's incorporating healthcare providers, but nurses, APPs, and all of those nurses that want to join us in terms of a strong advocacy voice in California. We've also worked with CNA and ANAC. We're just beginning to partner with them in having a stronger environmental health voice for California. So please go to the website, check that out. We have some interesting committees. And Lisa Hartmeyer, who's a current NP at UCSF, has been working on greening hospitals with UCSF and other colleagues, and she'd be happy to have you join her. Next. And I think resources, so you can look at those. If you want to just flip through those, please, that would be fine. Next slide, and you can look at those. And I'm looking forward to the discussion. Thank you for your attention.
Thanks so much to Lisa and Karen for those fantastic presentations. We do have about 15 minutes almost for questions, so please feel free to enter them into the chat, and I'll share them with our 2 speakers. So Catherine Brooks has sent in one question, which we can start out with. The question is, are there existing statewide indoor air standards or policies for schools? If so, how is CDPH and other state agencies supporting schools to improve ventilation and update buildings to achieve these standards? Lisa or Karen, whoever feels comfortable answering that. Oh, sorry, Karen, I think you're still muted.
I think it's a very timely question, and I don't have a great answer for it. I know that in the past 3 to 4 years, we've had monitoring throughout several schools in the Bay Area that was done by the EPA and partnered with other state agencies. We have, and that's intermittent throughout the Bay Area. So we have good data on that, particularly in San Francisco, that our buildings are old. They have a lot of pollutants that our children are exposed to. And we know that the mitigations at the moment are air filters and particularly indoor air humidifiers. So those both help significantly. But I think this is an area that we need to push on. Those on the call that may have more expertise in their school boards maybe know what's going on locally with those. But I think it's remained a challenging issue for the legislature statewide because of the cost, particularly in a lot of our older schools. So I don't know, Dr. Patel, if you have anything to add to that.
I do. If I could just be enabled to put a link into the chat. So I'm a part of a Climate Ready Schools Coalition, and I'll put the link in the chat. We came out with a report a couple of years ago that really brought a holistic view to how we think about how to improve climate readiness. And the way I had come into the work was thinking specifically about the ventilation issue, thinking about HVAC systems because it had a dual benefit, right? We understood the importance of both ventilation filtration for the pandemic, but it's also important in terms of filtering out wildfire smoke, air pollution, and making sure that those classrooms are cool on hot days. Because what we're beginning to see, both my children are in San Francisco Unified School District, where I think the last time I talked to the director of facilities here, maybe 5 of the buildings had HVAC systems, and the rest they just rely upon opening the windows because we've never needed it in the past, right? And so SFUSD's plan for right now is just to continue to use portable air filtration devices because, to Karen's point, there is a $10 billion infrastructure gap in the state in terms of the amount of money we've spent on our school infrastructure. So we are very far behind. A government accounting office report during the pandemic showed that and again, the data on this is we don't have because we don't collect this information in a systematic way, but we think 40 to 50% of schools either don't have systems at all or don't have adequate systems to ensure clean indoor air quality. So there's a bond coming up for schools in the next year. Part of this is an inequity issue. Richer districts put bonds up more often for their school districts, so their schools don't fall so far behind on infrastructure. And so this coalition is working on ensuring that those dollars are used in an effective way in terms of protecting kids' health. So I'll put the link to the Climate Ready Schools Coalition for any folks that want to learn more about that work and how you can get involved. And the last thing I'll say is that there are Inflation Reduction Act dollars. There have been federal and state dollars to make these kinds of infrastructure improvements. The problem is that the districts that need it the most are so pulled apart that they often, it's bureaucratic to access that funding to begin with. So it's really just a capacity issue to be able to apply for and navigate those funding sources more than that the funding isn't there.
Thank you. That was super helpful. And feel free to keep the questions coming, folks. Piggybacking off of that a little bit, Dr. Patel, you mentioned since it's an election year, obviously a lot of us are thinking about what we can do at sort of a civic engagement level to help promote climate-friendly solutions. Do you or Dr. Dunderstadt know of any specific propositions or anything that might be coming up that help to address this? Yeah, would love to hear more.
Yeah.
There's a referendum that is coming up, and I'll also drop this link in the chat. I believe it is on April 15th. We are doing a session. Basically, a couple of years ago, the environmental justice community that had long been organizing to create setbacks for oil, California, although we are progressive in a number of ways, we had no rules about where you could have an oil drill. So there are drills right next to schools, right next to playgrounds, right next to people's homes, and it more often happens in communities of color. There is an abundance of evidence that shows that this is terrible for health. We know that the effects are worse up to about half a mile, and the effects can last up to a mile. So this was the most aggressive setback rule that had been passed in the entire country to 3,200 feet. Right after this legislation passed, the oil industry paid millions of dollars to basically get this put up as a referendum and to get the law repealed. If it is repealed, there's basically no way to reintroduce it. And they are spreading all kinds of misinformation saying that it's going to result in increased energy prices when all the bill does is say that you cannot build new sites of drilling next to a school, playground, home, basically sensitive facilities. So please vote. I will not tell you which way to vote on this, but please access your right to vote to protect our children's health.
Yeah, thank you, Dr. Patel, for that. And our California Nurses Group has been working really closely with the CSU faculty. In fact, we're presenting a conference down there in June to really focus on this issue, particularly because Kern County is ground zero for that issue with the oil wells. And the referendum, if it passes, they won't really need to change anything of their current practice there, which is just so concerning after all the work that so many people in California did to get that on the ballot to begin with, or to get it in the legislature to begin with. So yeah, please get out the vote on this.
Thank you. Yeah, and it looks like we're working on finding a way to share some links. Dr. Patel has some links that she wants to share with everyone. Dr. Patel, you mentioned briefly how some of the solutions that we sought during the height of the COVID pandemic could have kind of a dual benefit with things like the air filtration quality and stuff. I wonder if either you or Dr. Dunderstadt could speak to a little bit about some lessons learned from the height of the COVID pandemic, or things that we saw, ways that it had an impact, potentially a silver lining impact on climate change. I'm thinking about things like working from home, maybe reducing emissions of cars to and from work, or other sort of surprising lessons that we learned that we can use to sort of like shake things up and jumpstart some of our solutions.
You know, I think in the stats that I showed with the American Lung Association stats, I am always expecting to see a better outlook for the Bay Area because we've really had such a switch to, you know, work at home. But, you know, we're seeing the return of the pollutants, and also because, you know, the atmospheres continue to absorb more and more. So I think, you know, even with less traffic, perhaps we're having similar pollutant levels. So we'll see what the 2024 level changes shows us. But I think in terms of healthcare providers, certainly they became much more aware of the air quality and advising patients, you know, regularly on the air quality and how that impacts particularly those patients with asthma. So, you know, it has changed practice as I see, and I'm sure Dr. Patel has seen this as well, and how we care for patients and how we advise families.
Yeah, I agree. I think I will say I wasn't expecting to become an indoor air quality expert. It's just something that had to happen because I had a background in environmental science. And I think what I came to appreciate from it all was that we have oh my gosh, there's decades of evidence about the importance of indoor air quality to health. And the pandemic made it very urgent, again, for the purpose, not necessarily for the quality, but for ventilation and filtration, but it has dual benefits. There's just so much evidence about kids that live in polluted neighborhoods, and because that pollution gets inside and it affects their test scores, it affects their health, asthma exacerbations, all the rest. There are just a million reasons why we should be investing in indoor air quality. And I think the pandemic really brought laser focus to it in a way that has been needed for a long while.
Thank you. And I apologize. I'm just thinking some of the questions that are coming in through the Q&A, so I will try to ask some of these. There's a question from Dr. Anne-Mary Franks. Are the doormats holding the pesticides and then dragging them in on shoes?
Yes, and that was an interesting finding in Dr. Alcon's study that, you know, we do know that we carry a lot in on our shoes from a variety of areas, and particularly if you live in an agriculture area, and soil is a big significant issue in terms of contamination there. So the answer is yes. And so you have a couple of options. Of course, you can do the clean shoe in the household like many people do. Children sometimes cooperate with that. But whatever works best for you, I think it's eliminating that contamination from the outside coming into the household, and particularly in these areas that are high agricultural areas, or where people may have been in areas where they might bring in more contamination to the household. So it's an interesting finding that that's something we can act on in terms of our current, you know, daily living.
Absolutely. Richard Jackson asks, as you well know, child health providers are under huge work and time demands. What would be your first and strongest recommendation on managing these threats for very busy clinicians?
Well, I think I've worked in outpatient, as Dr. Patel has, I'm sure, part of her career. And so I do think that some very significant handouts, like one-pagers, primarily visual, that you can give to patients, and maybe even posters on the wall, things in the waiting room where patients are waiting, that we can really make a difference in their thinking in terms of their approach to climate health and their own family's health. So there's a couple of suggestions there. And I know other providers have actually focused on those kids with asthma. You focus more on the issues around air quality, depending on the patient's diagnosis or travel. I mentioned that with the vector-borne diseases. You know, we kids that we prophylaxed at San Francisco General went to an area where there had been a change in vector in terms of malaria, and they came back with malaria symptoms. So it's very significant in terms of being aware of your area, what they could possibly be exposed to, and then either visually in your area, if you don't have the time, or handouts, try to, you know, give that information to families and children.
Yeah, it's I have the luxury of being inpatient, and frankly, I chose inpatient because I didn't want to be told 15 minutes to talk to my patients. And so I get to spend a half an hour with my patient if I want to. But one of the, I work a lot with outpatient pediatricians, and this comes up a lot, right? I feel like people in primary care have basically at their doorstep are all of our policy failures that are being asked to be addressed in a 15 or 20-minute visit. And so how do we balance that? So one of the ways that I think about it is start integrating counseling into the places that feel the highest impact. And so I'll say, for example, unfortunately, all of us are dealing with children that are experiencing asthma in some way, shape, or form. So start integrating counseling about how to read an air quality index, how to do a DIY air filter. If it's a family that's experiencing economic insecurity and can't do a portable air filter, talk to your families about the indoor gas stove, right? There are concrete pieces of counseling that are going to make a tangible difference in your patients' lives, and you don't have to do it all. Just start where your highest impact, and then just slowly build from there. I've made it a part of my practice to talk to all of my newborn families about heat and about air pollution as part of my counseling. And we just have to build our capacity, because I think, to the point of, there's so much to know here and it can feel so overwhelming. And Dr. Singal, I think you said this well. So don't start with all of it. Start with one thing, and then you can build from there.
And I also think small changes can have a big effect. I think we need to remember that, because we spend a lot of times indoors. Children spend more time indoors than they used to. So that being said, even the air filters, the humidifiers, the area of gas stoves, all those can make a big difference in terms of the environment inside, which reduces our overall exposure in outside areas as well, from outside areas.
Great, thanks. I think we probably only have time for one more question. There was a question from the audience. The community is facing high risk for PM 2.5. Are they making safe air zones?
Not to my knowledge. I think what has happened, from what I know about redressing these historic, the pollution that has happened, there was AB 617 that went to communities that have suffered a disproportionate amount of pollution to come up with plans on what they could do with those funds to better protect health. So we were working with Stockton, which is in a very polluted port area. And they had received, I want to say, somewhere on the scale of $100 to $200 million from that bill to help keep residents there safe from the pollution. And so that's as much as I know about how we clean up the pollution that's there.
And I think there has been increased funding, I agree, to school districts as well, in terms of mitigating some of the indoor air quality issues. But I do think as citizens and as parents, we need to monitor the implementation of those bills and that money, because it can get used for a lot of different purposes. So I think it's a strong role for healthcare providers and for parents in terms of advocating, if there's money that comes to the school district or to the community, to make sure it's spent on those areas that are most vulnerable and not on the greatest need at the time. So that's true with all of our legislation. The implementation is really the key here. And as citizens and families, we need to monitor that and call people to attention on it.
Thanks so much. We are very close to being out of time, so I will pass it off to Dr. Weiser. Thanks to Dr. Patel and Dr. Dunderstadt and the audience for so many great questions.
Wonderful. Well, thank you to the excellent speakers and moderator for your insights today. And thank you also to the audience for your great questions and interest in the topic. We look forward to sharing the recording with registrants and seeing you on May 29th. And again on June 12th for the next webinars in our spring series on the health impacts of climate change across the lifespan. Thank you all and have a very nice day.